Message from the Senate, and this is the Dean M. motion. Mr. Speaker, I hereby announce that the Senate has concurred in and adopted the report of the Conference Committee on Senate File number 800, an act relating to human services, finance, and policy. The report is addressed to the Honorable. Where is it? Okay. That's not. To the Honorable Michelle L. Fischbach, President of the Senate, and the Honorable Kurt L. Doudt, Speaker of the House. We, the undersigned conferees for Senate File 800, report that we have agreed upon the items in dispute and recommend as follows. The report is signed by 4 of the 5 conferees on behalf of the Senate and 4 of the 5 conferees on behalf of the House. Dean M. moves that the report of the Conference Committee on Senate File 800 be adopted and that the bill be repassed as amended by the Conference Committee.
I recognize the author, Representative Dean, who will explain the report.
Thanks, Mr. Speaker. First of all, I'd like to request a roll call.
Roll call being requested. Seeing 15 hands, there will be a roll call. Representative Dean.
Thank you, Mr. Speaker and members. This bill is a Health and Human Services Finance Bill, and it spends about $14 billion in 1819. And excuse me, I had to run up from downstairs. No, not at all.
It's like someone planned that, Representative Dean. It's almost like that. Representative Dean.
Not at all. It's $14 billion. We have members. There is, we've got significant savings within the bill, and we're going to talk a lot about that. We're also going to talk a lot about the savings within the bill, also about the good things that we do within this bill. Mr. Speaker. Also, Mr. Speaker, could I just ask Representative Schumacher to just talk a little bit about some of the policy provisions?
Representative Schumacher will yield. Representative Schumacher.
Thank you, Mr. Speaker. Members, and I'm always out of breath, so this is okay for me, the way we do this here. For a lot of what we had, we were pretty successful with our negotiations with the Senate in order to keep a lot of the great provisions that we had in the bill when it left the House. We did adopt some of these things that the Senate had that we really enjoyed as well, and we have a pretty good bill to present and vote on tonight when it comes to some of the provisions that we're actually able to bring forward today. A couple of the things that we wanted to address specifically. First, the inflationary increase for the group homes throughout the state is still viable in this bill, so that they should be able to receive a 7% increase in their inflationary rates starting on July 1st, which they can definitely use. We know we've been talking about that for several years now and how they can use that, and so we'll be able to utilize that. One of the things that we brought over from the Senate that we didn't have before was the Min Choices program that was offered by Senator Abler and worked on throughout the session. It provides some administrative reforms, especially to some in the disability community, and that we are able to bring some savings in from that. Another provision that we brought over from the Senate included the elderly waiver provisions that we had. There's a lot of reform there. Many of you remember what we did with the nursing facilities over the last 2 years. Well, we were able to come back and do some even more reforms so that we provided more access for seniors, keeping them out of the most expensive forms of housing, being nursing homes, and keeping them in more of a home setting for themselves and or in their homes with elderly waiver, and trying to make that a more viable program and keep that sustainable into the future. Beyond that, we did do some other reforms. Both the House and the Senate had some changes to the way that we do the DWRS, or the DWRS system, and we were able to take some of the House provisions, but a lot of the Senate provisions in the end to get that done. For that, we're able to find some more sustainability in the process for the formulas that the DWRS system relies on, and going into the future, that'll be better for providers as they move forward. With that, Mr. Speaker, I will yield back to Chair Dean for any further comments.
Chairman Dean.
Thank you, Mr. Speaker and members. And I just want to talk just very briefly about the scope of the bill and kind of where we're at. I am really proud of the work that the committee did on this bill, both the policy committee with Representative Schumacher's bill as well as the finance committee. I'd like to thank all of the contributions from the Democrat members of the committee. Many of those provisions are included in the bill, some are not. Also, I want to thank the conferees for working on the bill for a very, very good product. Members, you're going to hear a lot about the politics around this thing, you know, the where we are, how we got here, the process. But at the end of the day, our bill touches every single Minnesotan in very, very important ways. Our Medicaid portion of this bill touches over 1 million Minnesotans, 1 in 5 Minnesotans through Medicaid, through all of our health care programs. Really, really good-hearted people who work to care for the people who need it the most. Disabled kids are paid for within this bill. Kids who are abused, how they deal with life, how they get help, how they recover, that's paid for in this bill. Child care is paid for within this bill. People with developmental disabilities, adults with developmental disabilities are paid for within this bill. People who struggle with opioid and alcohol and other addictions, how they get care is paid for within this bill. So that's where you talk about all of the care that we provide, all of the caregivers are paid for within this bill in all 87 counties in the state of Minnesota. I am extraordinarily proud of the work that they do on behalf of grateful patients and their families all over the state of Minnesota. Now you can talk about how the governor's letters and the Democrat response has been very sharp and responsive around the savings within this bill, and I can talk about that very, very directly. The bill saves about $500 million, and it should, and I believe it should save more than that. When I got here a dozen years ago, Governor Pawlenty said, you know, if we don't do something, the Health and Human Services budget is going to consume the entirety of our budget. And we were spending, as somebody can Google what the budget was in 2005, but it was 20-some billion dollars. And now here we are at 14 billion in 18-19, 15.2 in 2021, not including the federal dollars, which is almost a match to that. So if you think about that, just think about that. Think about the fact that we've got a little over 5 million Minnesotans, okay? Think about, you know, we've got elderly folks that aren't working, kids that don't work. And just the spending on every single Minnesotan in health care is about $10,000 per person per year. It's a little less than that, but it will approach that and eclipse that this year. So just think of that if everybody worked, what it would take to make $10,000 per year is about, Representative Hertas will tell me it's probably, he'll get the math exactly correct, but it's about $5 an hour. If you double that, because if you think half of the people are elderly or not fully employed or children, it's about $10 an hour. So the first $10 an hour for every single person who works in Minnesota goes to health care. And if you just think about the enormity of that and how much that has had to grow. If you think about people in the districts all across the Minnesota, middle-class Minnesotans who are in a vice, who are working harder and harder and getting less and less. And all of you ran for election last time, so you all heard from them. And they say that it's not fair. About the fact that people who pay for their health insurance through writing out checks or their employers do, that it's not fair for them anymore. This bill gets at some of that. It doesn't go far enough that I would like it to go to, but it gets at some of that. It takes out the medical inflation, which actually is one of the things that I'm sure that will be criticized from this, but it's something that we absolutely have to do because we can't afford to have the Health and Human Services budget grow at such a rate that it eclipses everything. Wouldn't we like to have $2 billion and add it to the surplus? What would we do with an additional $2 billion? Representative Davids might like to have that for tax relief. Representative Nornes, what would you like, if we had an additional $2 billion that wasn't just automatically growing in Health and Human Services through entitlements, wouldn't you like to be able to look at that and say, couldn't we do better for our higher education in our universities and students? Couldn't we give the money back to the taxpayers who work really hard for that? So I think that that's something that we really need to do. We also look at how are we spending money in healthcare. There's a woman that we talked about this year in committee. She had been to the emergency room 73 times in 1 year. 73 times in 1 year. And nobody said, why are you going to the emergency room every week? More than every week. We look at coordinated care to try to bring down the total cost of care. So they say, well, that's phony. That's smoke and mirrors. That's pixie dust. You can't ever pull that money out of the system. It automatically has to grow and grow and grow, and there's no two ways about it. But I reject that. I reject that idea that we can't do anything about the growth in spending in health and human services. And we also need to look at choice, because people have fewer and fewer choices of where they're getting their health care. And if you live in greater Minnesota, 2005, you probably had 5 choices if you went out and shopped for individual health insurance. Today you got 1 or 0. And that health care might be in another county with high deductibles, premiums, and copays that makes you have to go to the bank to take out a loan to pay your health care or to put it on a credit card. And we're starting to get at that. We've done that through House File 1, through House File 5, and now here again we are working at trying to restore the individual health insurance market by bringing down the cost of care where it is delivered. We also care for the elderly, the disabled in this bill. And when I was a freshman, one of the pieces of advice that I got was, you should, whether you're in the minority or the majority, you should always try to vote for the education bill and try to vote for the health bill if you can, because it does the most good and it touches the most people in the district. And we should, as Minnesotans, try to get behind those bills no matter who's in charge. And as you see from what's going on in Washington, D.C. and what's going on here in Minnesota, things just got off track and aren't able to support the party opposite through the things that we are really core services in our job here in the state of Minnesota, and I think that's a bad thing. But this is something that we can absolutely get behind, and whether or not the governor says he's not going to sign this, I hope he does, because this really does get at what we need to get at for reforming our health and human services programs. And if he doesn't, we have to do this again. It's not going to look that much different. The spending is not going to look that much different. There might be a few policy differences that might be different, a few directions here or there, but the hyperbole around this has really got to stop. It's really got to stop. It's over the top. And I believe that the governor can and should sign this bill. If he can't, then I really wish we would be able to get realistic about this, because this is our job. The people are really depending on us, the people with disabilities, the elderly, the frail elderly, and the people who need our help the most. So I hope we're able to rise to that occasion, to finish our work on time and work with the governor on this. Our conference committee has put together an excellent piece of work that does a lot of good things for a great many people across the state of Minnesota. I'm very proud of the work that they have done, and I'd ask you to support it, and I'd be happy to entertain any questions, as would the members on the committee.
The member from St. Louis, Representative Schultz. Thank you, Mr. Speaker. I make a motion to refuse to concur with the Senate File 800. And I would like a roll call, please.
Roll call being, seeing 15 hands, roll call being requested. The clerk will take the roll. Oh, no. Any discussion? Sorry about that. Representative, no?
Mr. Speaker.
All right. Oh, the clerk will report the motion.
Schultz moves that House refuse to adopt the Conference Committee report on Senate File number 800 and that the bill be returned to the Conference Committee.
The member from St. Louis, Representative Schultz.
Thank you, Mr. Speaker. Well, if Republicans really cared about people, then maybe they would listen to the people. I have frequently heard from the Speaker and other Republicans that you want to have open Conference Committee hearings to hear the voice of the people, that you want bills to be signed by the governor. But in Conference Committee, as a conferee, I asked if we could have public testimony, and the answer from the Republicans was no. I asked if DHS, the agency, could testify on the second day of the Conference Committee, and the answer from the Republicans was no. This Conference Committee report is 585 pages. When the Conference Committee met, the DE amendment, which was the only thing voted on, we did not vote to adopt a Conference Committee report, that was posted the morning of the Conference Committee hearing. We have only spent about 4 hours in Conference Committee debating a 585-page bill. New policies were added. There was language that was changed that was never brought to committee, never brought to the floor to debate. It was brand new. That's why it was important to have people there to testify. On Saturday, Senator Lurie and I were asked by the governor's office to come to the Capitol to meet with the leads on the HHS Conference Committee to discuss the budget so they could discuss global targets. And the leads came into the room where Senator Lurie and I sat and refused to meet with us to discuss solutions, a compromise to the HHS Conference Committee budget. The actions of the Republicans are what matters. This bill, this Conference Committee report is so important because it affects every person in Minnesota. And all lives matter, and that's why this bill matters so much. The actions of the Republicans show that they are not serious about having an open, public, and transparent process, that Republicans are not serious about compromising, and the public wants input. They want us to finish on time. And we're trying, as DFLers, to help you put together bills that the governor will sign that will benefit people in Minnesota. But the intent of this Conference Committee report is to cover fewer people, to help fewer people, to help people in Minnesota. And if you were serious about the growth in this budget, you would have had offered bills or heard DFL bills that addressed the cost growth in health care. But that's not what's happening in this legislation. Refusing to work with us to finalize the budget is not going to work for Minnesota. It's going to lead to a veto, and we're running out of time. It's clear in this bill that Republicans have prioritized corporate interests over the public's interest. This bill, if passed, will drive Minnesota into very large deficits in the near future because many things are pushed out into the tails, out beyond 4 years. And that's not what Minnesotans want. So I urge everyone to vote green to refuse to concur with the Senate file. Thank you.
Representative Schultz, my understanding is you requested a roll call, and seeing 15 hands, there will be a roll call. So thank you. I just had to document that.
Thank you, Speaker. Yes, I did.
Member from Blue Earth, Representative Considine.
I'll come back.
Member from Hennepin, Representative Flanagan. Okay. Any discussion on the motion to refuse to adopt? Seeing none, the clerk will take the roll. So then, members, please vote. The clerk will close the roll. There being 55 ayes and 75 nays, the motion does not prevail. Members, we're on the motion to adopt by Dean of Washington. So now you guys do want to talk. Okay, so the member from Blue Earth, Representative Considine.
If I can get my own people to. This bill is reprehensible. A little while ago, a couple people were joking with me and said, "Oh, I wonder how you can we can look you in the mirror." And on this one, yeah, I wonder how you can look yourself in the mirror. There are people at the security hospital that are dying. There are people that are being permanently maimed. Quite a few of you saw the video of the employee that now has permanent seizures and her life has been thrown into tatters. And there is not any money in this bill to increase the staff. Even though they are at a staffing ratio that is at 2/3 of what other hospitals like this do. Nothing in this bill does anything to help them. In fact, they will end up laying off workers because of this bill. So more people will die. More people will be permanently injured. More people will have to look at their loved ones in the security hospital and say, they're not safe there. This bill is reprehensible.
Member from Hennepin, Representative Flanagan.
Thank you, Mr. Speaker. So as we are here this evening, there are at least 4,652 families in Minnesota on the waiting list to access affordable childcare. Colleagues, we spent almost a year traveling the state, listening to families, listening to providers talk about the need for real reform and the need for real investment in childcare. So much so that we created the Legislative Task Force on Access to Affordable Childcare. We set out to find answers, and we found some. We talked to parents and child care providers, to state and county officials, spent months crisscrossing the state to learn about problems facing working families and the centers that care for our children while parents are away at work. The bipartisan team of 4 Republicans and 4 Democrats came together and released a comprehensive 57-page report detailing exactly what we learned from the experts and the people on the ground, and specific steps that we could take to address the problems ahead. For example, we learned that we needed to reform and invest in the Child Care Assistance Program, which helps low-income families find affordable child care. By increasing the CCAP provider reimbursement rates, changing eligibility for CCAP from 6 months to 12, and allowing child care providers who are guardians or foster care children to be eligible for CCAP reimbursement, we can make targeted changes that will allow more working parents to have access to child care and pay providers who really need to keep their doors open. We also learned that child care providers were often spending so much time doing paperwork that they weren't able to give children the care that they needed and deserved. So we decided that the legislature should simplify regulations and standardize enforcement. We learned that many providers, particularly those in greater Minnesota, were not able to access the training courses they needed to complete, and that the state should therefore make those trainings more regular and easier to get to and from in rural Minnesota. And finally, we learned that middle-income families were often forgotten in our discussion about childcare because they were ineligible for assistance and yet priced out of childcare centers without it. So we decided that we needed to expand the existing childcare tax credits and consider other incentives for businesses to invest in on-site childcare. After months of travel and research and public testimony, this bipartisan task force has finally landed on a set of concrete policy proposals that could solve our childcare crisis in Minnesota. It was a surprising victory given the usual partisan gridlock at the Capitol, and I was eager to get back to work to St. Paul to work on these reforms. And then the 2017 legislative session started, and not a whole lot happened. Despite the rhetoric from Republicans about their commitment to making child care more affordable, despite creating a brand new subcommittee specifically for child access and affordability, and despite assurances in public and in private from House leadership that this would be the year that we actually got something done, the Republican budget passed with barely a nickel to make child care more affordable in Minnesota. All of this, in a word, is infuriating. The comprehensive report for which taxpayers footed the bill went straight to the recycling bin. And Republicans' complete indifference to the struggling working mothers and fathers who are desperately trying to find affordable child care for their children left me wondering if this was just a show all along. There's no increase in the Child Care Assistance Program basic sliding fee. In fact, there's a $3.7 million reduction per year. This is not what we set out to do, colleagues, and what is so unfortunate is that there are additional bills for child care co-op. Representative Baker had a bill on community initiative funds to make child care more accessible throughout Minnesota. And we are not investing in our families in making childcare more affordable and accessible. It is a mistake. And this is one of the spaces, one of the unique opportunities that we have as Republicans and Democrats to come together to help working families all over the state. And this bill lets them down. Vote no.
Member from Hennepin, Representative Loeffler.
Thank you, Mr. Speaker and members. Well, we heard Representative Dean talk about the need to control costs in this budget and how he wished we could go back to the budgets of the old days when Governor Pawlenty was here and how much the growth of this budget has grown. But this budget doesn't invest in some of the most cost-effective services that we have that actually do help control our costs. And we can't stop the aging of Minnesotans. We know there's demographically a baby boom wave that's going to keep challenging us to step up for seniors who exhaust their lifetime savings but still need extra care and health care and support. And while we all celebrate the medical miracles that saves so many tiny little babies. It's just amazing. But 5 or 10 or 15%, depending upon what their challenge is, don't get the miracle. And they have a life of dependency that depends on us stepping up to make sure that their needs are met from the beginning of life all the way through old age. And who does that? It's the caregivers that Representative Dean said he's so proud of. It's the people, mostly women, who step up to do home care, who are the PCAs for children with disabilities, who go visit grandma in her home or grandpa in his home and makes it possible for them to stay there. And they earn $10 to $12 to maybe $13 an hour. And we can't fill those positions. There are 9,000 vacancies at the start of session. And I can tell you, I just the other day went to an Aldi's that was advertising $15 an hour to work part-time at retail. Are you going to do the emotionally difficult part-time, juggling multiple locations work of home care with almost no backup? Or are you going to step up to Aldi's and make 10 to 20 to 30% more? People are in desperation. And what's happening right now, and we heard it in committee, is that we have desperate parents who cannot fill the shifts to cover the absolutely medically critical need that their disabled child needs. And so they're giving up their careers because they can't keep trusting untrained people being sent out by agencies who are willing to hire anyone, and then having to train them and spend their entire day at work worrying about whether or not that child is getting the right kind of care and supervision. It's seniors who could be served cheaper living at home with a home health aide who comes in and helps them with bathing, with medication management, those sorts of things, because their children are not able to do that. They're at work. And we're hearing from middle-aged people who are trying to get leaves of absence and quitting their careers because they can't leave mom in that desperate state. And we've had such success in getting people with disabilities into the employment world, but they're totally dependent, some of them, in getting out of bed and getting into the shower and getting dressed and getting into their wheelchair and on the braces and their medications so that they can go to work. We're hearing from them that they can't find, even though they're bright and smart and have their heads about them, but have serious physical disabilities, they cannot get consistent care. And some of them are giving up weekend care in a negotiation with agencies so that they can at least stay employed. These are people who otherwise are going to go to nursing homes. Some of them who are ventilator dependent, their only alternative is to go to the hospital if someone doesn't show up for a care and doesn't show up for a shift or decides to take that job that pays 10 or 20 or 15 or 30% more. And this bill does nothing to step up and solve that crisis. And it is a crisis because we heard that the Department of Health's Office of Health Facilities Complaints, their complaints of abuse, neglect, and maltreatment have grown so fast that they can only respond to the 10% that are most serious. So even though your mother or your child or your grandma is getting inadequate care and you're trying to get that supervision, we don't have it there. This is not showing the kind of priorities that we should show, stepping up to support the most cost-effective services we have in Minnesota, which is serving people at home, helping them get to jobs in the community, and honoring the workforce that steps up to make it possible for other people literally to live. This budget needs to go back and be redone.
Member from Olmsted, Representative Liebling.
Mr. Speaker, members, Health and Human Services, the bill before us, is supposed to support Minnesotans. This is the bill where we are telling Minnesotans, where we should be telling Minnesotans, your life and your health and your participation in our society matters. Those are Minnesota values. We do a lot in this state for people with disabilities in particular, and I think that Minnesotans are very proud of that. We in this state believe that people with different challenges should all be able to participate, and we know that people do. Every one of us has different kinds of challenges. But in this state, Minnesotans believe that no matter what kind of challenges you start out with, that we as a community should have your back, that we should lift each other up and help each other to have full participation. So that's what should be in a Health and Human Services bill. And in that respect, this bill fails utterly. This bill hurts the very people who look to us for support. Now, it's really hard to talk tonight about this Health and Human Services bill in Minnesota without making reference to what just happened in Washington, D.C., where the so-called American Health Care Act just passed the U.S. Congress. It passed the House of Representatives. Right, it passed the House of Representatives. Thank you, Representative Erickson. So, I call it the Republican Health Care Act. It was voted upon, it was passed only by Republicans in the U.S. House of Representatives. And what does it do? It cuts health care. Of course, we really don't know exactly what it will do because they didn't have the scoring, as they call it, the analysis of the bill before it was voted upon. And in fact, it was pushed through so quickly that it is very, very doubtful that many of the Republican members who voted for it actually knew what was in it. But as the details roll out, it's pretty clear that one of the things it's going to do is cut Medicaid and throw a lot of people off of health care. And another thing that it's going to do is allow discrimination against people who have pre-existing conditions, which is an awful lot of us. So that hurts people, and one of the big things that that bill also does is it cuts a lot of taxes for a lot of wealthy people. So why am I talking about this? Because what we do here in the state is in context of what happens in Washington, D.C. These things are not separate. A lot of what we do in Health and Human Services is in reaction or allowed by or often paid for by or partly paid for by the federal government. So this bill is in the context of what is happening there. And it's really quite similar, in fact, to what is happening in Washington, D.C. Because what this bill does is it throws into jeopardy the health care of a lot of people in this state. Now, when Representative Dean was introducing the bill, he made the comment that this touches Minnesotans in many ways. And he commented accurately that over 1 million Minnesotans are on our medical assistance program. That's about 1/5 of all Minnesotans. Unfortunately, the way this bill touches them, it's not going to be a very welcome touch. The reason that I say this, and people watching need to understand, it's not a bad thing to save money. It's not. This is a growing area of the budget. We know that. We see it all the time. And for a lot of the reasons Representative Loeffler spoke about, we have an aging population. That's one of the reasons. Healthcare continues to get more expensive. That's another reason. We have all kinds of requirements, and we want to do better for our people with disabilities. We want them to live independent lives. And of course, it's more expensive to support someone independently than in a collective institution. And it's sometimes more expensive to support them so they can live a full life. But the savings in this bill are not real savings. The Republican majority did not do its work. It did not do its work. This bill is full of shifts and tricks and gimmicks in its funding. And so all the things that are good that are funded in this bill are not really funded, because this bill, if it became law, would not work. Shifts, tricks, and gimmicks. So I'm going to talk a little bit about what those are. When I talk about shifts, one of the things in this bill in a time of surplus is a payment delay. So it's a little trick, it's a shift, it's also a trick, it's a tricky shift. So you're shifting money into the next biennium by just making a late payment. So anybody who does basic budgeting at home knows all that does is push off your expenses. You still have to pay them. It looks better today. It looks worse tomorrow. There are tricks in this bill, and what I mean by tricks is that there are savings in the bill, big savings, that are not supported by any fiscal analysis. So maybe there's something going on here that the Republicans in the U.S. House and the Republicans here in Minnesota don't seem to need the experts to tell them how much they can save or how much things will cost. And that is a very troubling thing. Now, we can get a fiscal analysis, what we call a fiscal note here, and you can disagree with it because it's very detailed, and you can explain why you don't agree with this assumption or that number, and that's fine. But to put numbers on your spreadsheet without any fiscal note, that's just irresponsible. So there are a couple things in here that have no fiscal note to support them. They're big things. $45 million saved on a pilot project that Representative Dean likes the idea of doing some direct contracting with providers. I like that too, but you can't make up the numbers. And that's what's happened in this budget. Then there's something we've talked about a lot, which is saving money, kicking off people who don't belong on the program. Audits, more eligibility verification. This is something Representative Drazkowski's worked on. And I agree with that. I think all of us agree that nobody who doesn't belong on the program should be on it. But once again, you can't just make up the numbers. You can't just say, oh, we think it'll be this much and we think it'll be that much, and we'll just put a number on the spreadsheet, $140 million saved. Gee, that was easy. Doesn't work. Then we've got other things, what I would call gimmicks. One of the things the bill does is cut $20 million out of what we call our MET system, or what's really the DHS, the technology system that the Department of Human Services is using to do eligibility verifications, to determine who's eligible for our programs. So on the one hand, the bill claims a bunch of savings from kicking off people who don't belong on the program, and on the other hand, it cuts the very system that allows the counties and that is allowing the counties to do a better job making that determination. Just a gimmick. And then finally, one of the big things in the bill, and Representative Dean alluded to it, is it takes a big savings by pretending that inflation doesn't happen. It just claims a big savings, over $150 million just in the next 2 years, by saying, in essence, costs won't grow, healthcare won't cost any more, nobody new is going to need these programs, and the people on them aren't going to cost any more than they do today. Well, that just doesn't work that way. And what happens when you put these savings in the bill and you say, well, look, I saved $500 million. Great deal. What a great deal. And then, of course, you spent some money, too. So, that's fine. There are things that we should be spending some money on. And sometimes you have to spend money to save money. We all know that. Anybody in a business knows that. But this bill puts people's health care in jeopardy. This bill is not responsible budgeting. This bill is not accountable to Minnesotans. And this bill is not fair, because this bill will end up hurting the people that we say we're helping. And that is wrong. That is not Minnesota values. And so The governor should not be signing this bill. I'm pretty sure he won't. There's so many things here that need to be funded that are not. But even of what is here, the savings are false. And that is not the way we do things in Minnesota. Thank you.
Member from Dakota, Representative Halverson.
Thank you, Mr. Speaker. I'm sitting here and I'm listening to the debate, and I heard the bill introduction, and it's astounding to me that we're all talking about the same bill. And it's frankly very concerning to me that we are this far apart in defining the concerns that we have with our healthcare system and the solutions to those. We shouldn't be this far apart as a body. We shouldn't have this much lack of understanding of what the problems really are in our healthcare system and how we as a legislature can get in there and solve them. We're failing the people of Minnesota by not understanding this. And we are creating even more uncertainty in the lives of Minnesotans than they're already experiencing with the debate at the federal level. And we have got a bill in front of us that does not help define the problems that we're facing. These are the things we hear about from our constituents. We hear about the high cost of health care. We hear about concerns about people being able to get care in their homes from PCAs, being able to hire PCAs. We hear about life and death situations in our security hospital. And this is going to get solved with smoke and mirrors, as Representative Liebling was describing. We're not being honest with the people of Minnesota. This is too crucial a part of our state budget to play games with, folks. We need to get together. And Minnesota has a history of getting together and coming up with innovative solutions that have put us on the map as healthcare leaders. And I am watching that disintegrate before my eyes. The spirit of being able to put aside differences and come together for the people of Minnesota. I'm not seeing it. Minnesota, one of the really great innovations that we came to as a state in Minnesota many, many years ago was valuing a nonprofit healthcare system, and we had a law that required all of our healthcare HMOs to be nonprofit. Makes a ton of sense to me. I don't know a single one of us sitting in this chamber that wants $1 of our premiums going for a big fancy building, a big fancy CEO salary, or big fancy stock shares. We want our healthcare dollars to go to pay for healthcare. We know now that the premiums that we pay, healthcare's gotten so expensive, they're not even covering the cost of care. We need to deal with the cost of care. Nothing in here. So instead of continuing to build on Minnesota's tradition of innovation, we're whittling away at it. And earlier this session, we had a bill to give really important premium relief to payers in the individual market. And we passed that bill, but that bill had a big provision in it. You know, sometimes compromise is about coming together and finding common ground, and sometimes it's holding your nose. And I got to tell you, I held my nose because the Republican majority decided that the solution to high health care costs is to bring in for-profit HMOs into Minnesota. After decades and decades of valuing a nonprofit healthcare system, after being the one state in the nation that had over 90% of its premium dollars going to healthcare, not to profits, not to salaries, to the actual cost of caring for our family members. And so this is hanging over Minnesotans. It's very possible that these huge fish are going to come into Minnesota and buy up our local health plans. It's very possible. It's happened around the country. You see a lot of consolidation in healthcare and whittling states' plans down to 2 or 3 for-profit health plans. And that could happen in Minnesota. And we have to be prepared as a legislature for that to happen and what the impact is going to be. And one of the big impacts is going to be what's going to happen to the nonprofit health plan reserves that they've been required by law to keep and to build up. And they've built that up through private payer premiums, but they've also built that up through taxpayer dollars. Those reserves are there for a very important reason. And we've seen those reserves have to be used in the last couple of years with the high-end premiums in the individual market. And so those premiums went to help try to stabilize the rising cost of care. But where are those reserves going to go if a nonprofit HMO, one of the small fish, I know that we think these guys are really big, but when you look at the market overall nationally, we have small fish in Minnesota, and they're homegrown, and they're in our backyards, and there's call centers in Virginia, Minnesota, and there's call centers here in the Twin Cities, and employees all over the state that are Minnesotans serving Minnesotans. But we're gonna open it up and take those homegrown health plans and perhaps put them out there to become for-profit. And we'll see dollars shifting to large salaries. We'll see dollars shifting to pay off stockholder benefits. And Minnesotans don't want to see that, but if it happens, what's going to happen to those reserves that Minnesota taxpayers helped build up? Unfortunately, this bill came back very weak on those questions of how we're going to protect the consumer in this event. And I know that the Republicans think that this is going to be just a great answer to bringing down the cost of care and premiums. It's not. I know it's not. The great answer is making sure that our health care dollars go to health care. But instead, we've got these public assets that have some very loose rules in this bill around them about where the money can go. And it can go to some kind of a nonprofit. Doesn't necessarily even have to be a Minnesota nonprofit. There's not a ton of oversight provided by the Attorney General's office. And we got some really good advice from Minnesota's Attorney General about how we can make these conversions consumer friendly, how we can protect the taxpayer dollars that have been invested in building up state reserves for our healthcare organizations. And that's not in there. There's also not a requirement that these nonprofit entities are even that far separated from the HMOs that they could be serving. And we want to be sure that we can enforce this particular statute and make sure that these dollars are being spent in a way that really serve the people of Minnesota, that protect the taxpayer investment, perhaps even return the taxpayer investment. None of that is in here. And so with all the uncertainty we have, with the rising cost of health care, there's nothing in this bill that's going to protect the consumers. There's nothing in this bill that's going to bring the cost of health care down. There's nothing in this bill that's dealing with the root causes. We are innovators, Minnesotans. We come together for the people of Minnesota. This bill doesn't do it, and I would really like to see us come together and really have an honest conversation about the problems and really think about what the solutions are going to be that are going to bring the cost of care down for Minnesotans and make sure that people have access to the care that they need. Please vote against this bill.
Members were on the motion for the adoption of the conference report. The member from Hennepin, Representative Omar.
Thank you. Members, I rose last week on Monday to make an emergency motion to take up a bill to give resources to the Department of Health, resources I felt were needed to tackle the measles outbreak. Today, we know that the Department of Health is also dealing with other infectious diseases and really needs the resources to deal with this particular outbreak. Last Monday, when I addressed this body, there were 32 kids that were affected by measles, and just 1 week later, that number is at 50 right now. That means there are 18 more kids, 18 more children, babies, that are affected by this very preventable disease. As this crisis grows and more kids are harmed by this, we need to think about doing all that we can do. We need to make sure that we send this bill back, because as the Department of Health is tackling with dealing with these infectious diseases across our state, in particular the measles outbreak, it is not the time to underfund the Department of Health. This is a very critical time for them, and we need to make sure that we are giving them the adequate resources that it needs in order to be able to keep our children and all of Minnesotans safe. I ask all of you to think about Minnesota's most vulnerable. I ask you to remember the oath that you took, which is to do no harm. This bill is very harmful to Minnesotans, especially its most vulnerable. I ask you to send it back. Thank you.
Member from Hennepin, Representative Freiberg.
Thank you, Mr. Speaker. Infuriating, reprehensible, fails utterly, irresponsible, smoke and mirrors. These are some of the phrases and words that my colleagues have used to describe this bill. And I'd like to add one to follow on to what Representative Omar said, and that word is dangerous. So you might remember that we currently have a surplus in this state, approximately $1.6 billion. Yet this bill would impose a 7% cut on the operating budget of the Minnesota Department of Health. At a time when Minnesota is struggling with 3 infectious disease outbreaks, we're reducing the department's budget by 7% if we pass this bill, which would limit the department's ability to react and protect Minnesotans. Now, Representative Omar needs to be commended for her leadership for bringing forward her bill last week. After we had that discussion, I contacted the Department of Health just to find out exactly what they've been doing with their current budget, what they would do if they received some additional resources. One thing I didn't really think to ask them is what they would do with the 7% cut, as this bill would impose. But they've been doing amazing work with the limited resources that they currently have. Representative Omar mentioned that we currently have 50 cases. It's not confined to one community or to one county anymore. It's spreading around the state. It's the worst measles outbreak we've experienced in 25 years. But the Department of Health is fighting it. They've been working on response-related activities since April 11th. They've already accrued $200,000 in labor costs. The work done by their scientists, managers, and others has included disease investigation, family and daycare contacts, public outreach, and coordination with partner agencies. They mentioned that the outbreak shows no sign of abating soon and is likely to cost more than $1 million by the time it subsides. I know Representative Omar shared this letter also with Chairman Dean, so this is something we know about. And it's not just measles now. We've also seen an outbreak of syphilis in Minnesota. We've seen several cases of multi-drug resistant tuberculosis. This is not the time to be making these dangerous cuts. These are dangerous. Certainly, all the other words that my colleagues have used to describe this bill apply, but it's very troubling to me that when we are facing such a serious public health crisis on many fronts right now, we would consider cutting the budget of our Department of Health by 7%. I think we need to send this back to conference committee and come up with a budget, come up with a health bill that funds these needed resources. We need to stop focusing on tax cuts, and we need to fund our agencies so that they can protect our public health. This bill does not do that. We should send it back.
Member from Ramsey, Representative Fisher.
Thank you, Mr. Speaker. Just to follow up as to what's being said on the infectious disease outbreaks, there are several of them going on right now. One of the things that is very important to know is that on some of the outbreaks, the incubation period is 21 days or longer. In some instances, the department is having to follow up on thousands and thousands of contacts. I think one of the important things that people are not realizing at this point in time is that the department is severely stretched. I was meeting with some of the department people yesterday, and one thing that they're doing right now is they're taking people from other areas to help on the outbreaks that are occurring right now in the state. One of the disturbing things to me is that they're taking people from areas that deal with foodborne outbreaks and repositioning them to this area right here. They're starting to rob other parts of their department to try to handle the crisis that is going on at this point in time. The budget that we have will cut their department by a further 7%. This would reduce the number of people that can deal with outbreaks. And I think one of the things that our state has been very strong on in the past is the value of our state has been to have a very strong Department of Health. They are the ones in our country who've been recognized as being able to diagnose outbreaks when they occur and help provide training so that we have safe handling of food and of people who are vulnerable when they have vulnerable conditions and contagious diseases. Unfortunately, the cuts that we're looking at right now will jeopardize that possibility. And the reason these cuts are occurring is because we want to have large tax breaks out there. It's going to jeopardize the current value that we have and instead reposition the money so that we can give larger tax breaks to those who are primarily rich. And the fear that I have is that we're putting our public health at jeopardy for tax breaks. Please reconsider the funding of the Department of Health.
Members, on the motion to adopt the conference report, the member from Ramsey, Representative Murphy.
Thank you, Mr. Speaker, and members. I'll be voting no on this piece of legislation tonight. This proposal, maybe not when it was drafted, but now in the context of what we're seeing happen in Washington, will devastate, in many cases, what is reliable coverage for people in medical assistance, in Minnesota Care, and in MNsure. And when I think of those programs, and I hope you are too when you cast your vote tonight, that you think about children and families and senior citizens and people with disabilities who live all across the state of Minnesota. And I hope you think also of the people who are sick. Because when you take inflation out of medical assistance and say we're going to spend $2 million and other things in the state budget, it does mean that we will be cutting the care for people who get their care and medical assistance, and that's disproportionately people who are senior citizens and people with disabilities who live all across the state of Minnesota, and let me say disproportionately in greater Minnesota. So when you cast your vote, I hope that you're thinking about children and families and senior citizens and people with disabilities and people who are sick, because your vote tonight is impacting them, their face, their lives. We have good coverage here as members of the House of Representatives, and if we get sick, we get in a car accident, we get a serious condition, or our spouses do, or our children do, we are pretty assured that we're going to get good care and good treatment at one of the fine institutions in Minnesota, University of Minnesota, Abbott Northwestern, and the Mayo. That's where we get our care. And Minnesotans really shouldn't expect anything less for themselves than we have for ourselves here. And this bill delivers second-class health care for the people in medical assistance, in Minnesota Care, in MNsure, after the actions of this proposal tonight. For many, many years, people outside of this chamber worked to make sure that there were consumer protections in place for people who got their coverage in our programs with health plans. And there's a whole article in this legislation dedicated to repealing or weakening those consumer protections. And if this becomes law, it will be the case that if you pay your premium late, you can be kicked off your coverage just for paying your premium late. That, combined with what's happening in Washington, D.C., really unravels and undermines a guarantee of coverage if you purchase a policy. It puts the finger again on the scale of the insurance companies and puts the risk on individuals and their pocketbooks and their health. Earlier this week, I talked with a woman who told me about a 17-year-old with mental illness who lives in a community in greater Minnesota. And he has spent weeks in a windowless room in an emergency department in a hospital because there's no other place for him to go. He's stuck there. He's stranded there in an emergency room, playing video games, waiting to get care in a more appropriate facility. And there isn't one available right now. We're doing nothing to deal with that kind of situation. We're doing little to resolve the problem that we're facing in mental health in Minnesota. We're doing little with the workforce shortages in healthcare. We're doing little to make sure that we're paying fairly the people who care for people with mental illness, for senior citizens and people with disabilities. This bill has a big cut target. The cuts aren't real, but they will be felt by people when they're enacted. We just don't know yet where. That is a lack of bravery on your part. Those of you who are going to vote for this bill because you don't want to pay the consequence for the vote you're taking. You'd like to hide that from the people of Minnesotans. But you'll take the vote, you'll make the cuts, and you'll cut taxes for people who are well off at the expense of people who are sick. So, again, think about those people who are going to be impacted. People with disabilities, families and children, people who are sick, senior citizens, because those are the people that you are impacting if you choose to vote yes for this legislation tonight. They're counting on us. We're letting them down. Not me, but those who vote yes are letting Minnesotans down by your action tonight.
Seeing no further discussion, the clerk will take the roll. Members, please vote. The clerk will close the roll. There being 76 ayes and 56 nays, the motion prevails. The clerk will give the bill its third reading as amended by conference.
Third reading, Senate File 800, as amended by conference.
Third reading is amended by conference. Discussion to the bill. Member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker. And I just have one more brief thing I want to mention, and that is that this bill actually cuts funding for contraception for low-income women. And the reason I want to mention that, among all the terrible things that this bill does, is that we had a debate here not too long ago about public funding, about Medicaid funding for abortions. And people on this floor were just incensed because their constituents don't want to pay for abortions. Well, there's a pretty direct kind of correlation here, members. I don't think I need to spell it out for you. But what you're doing in this bill, cutting funding for contraception, is going to increase. It's going to increase the demand for abortions in this state. That's really sad.
The author of the bill from Washington, Representative Dean.
Thank you, Mr. Speaker and members. Just like to respond to a couple of things from the debate. I appreciate that. Obviously, look at it from a little bit of a different branch on the tree, and I think most Minnesotans do too. I would encourage you to talk to folks in your district, middle-class Minnesotans who have paid more and more and who get less and less from health care and from government in general, who are looking for a little bit more value, whose lives are being put in a vice as the costs of health care go up. either through their business or out of their checkbook, or just trying to make it day to day, trying to pay for the costs of a family. And their costs are going up. If you had a $490 premium a couple of years ago, it might be $1,750 today. If you had a deductible of a couple $1,000s, it might be $7,000 today. Your doctor that you were promised that you could keep is probably, you drive by that doctor, you drive by your hospital to get to another clinic and another hospital in another town to pay out of pocket because your health insurance doesn't pay for health care anymore. That's the reality, people. People are going to their credit cards, going into home equity loans, going into equity to try to pay for the health insurance, and it's not really even covering the costs. When we look at the costs that we're actually trying to find within this bill, we say, well, what about the government? Maybe they should try to find some money. Instead of asking moms and dads and business owners to come up with more and more money every year, maybe the government should do something a little bit differently. Maybe they should stop paying insurance to HMOs for people who no longer qualify for health care. But we don't do that. We can't do that. What about people who are dead? Maybe we should stop paying their health insurance. Maybe we should stop sending checks to HMOs for them. Could we do that? No, we can't do that. That would be too difficult. We can't do that. What about people who live in another state, who might be on another health care plan? We said, let's just make sure that they live in Minnesota, they qualify for their plans, and they're alive. Is that too much to ask? Before you ask middle-class Minnesotans to reach more into their pocket, to go onto their credit cards, to take out a loan, to pay for health insurance that they can't even use. We can't do any of that because it's just too hard. It's too much work. The government just can't do that. We absolutely have to grow, but you have to reach into your wallet. You have to get out the credit card. You have to go to the bank and get a loan to pay for health care that doesn't even pay for anything. That's what we're asking people to do. This bill says, let's check. All right. Hey, we're going to pay for your health care. If you're on Medicaid, you got zero premium, zero deductible, zero copay. You can go anywhere you like in the state for health care. You have choice. We just want to make sure you're here, that you qualify, and that you're alive. We ask the HMOs to go out and check. Is that too much to ask? When you talk to the people in your districts who are paying so much for health care, that's this fictitious savings that the other side likes to talk about. We asked in the last biennium, we said, let's go and check to make sure that people are here. So we had something called periodic data match. And the governor agreed to that, the agency agreed to that. Okay, we'll go through our files and we'll make sure that that we're qualifying folks that should be qualified. So in the committee this year, we asked, how's it going? How's that checking up going? Well, we haven't quite gotten around to it yet. Look at the forecast. Look at this spreadsheet. MMB is saying that we're paying $50 million in health insurance for people who don't qualify. 14,000 folks. Those aren't made up. That's MMB. That's what they say is out there. I think it's a lot more. And I think we need to find it, and we need to save those dollars, and we need to spend them in a better way. That's the savings that we're looking for. And in healthcare delivery, we're saying, let's get our hospitals involved, let's get our clinics involved, let's get the doctors involved in actually coordinating care. That was a Representative Liebling idea. I think it's a good one. That maybe we could direct contract and that we can work with folks. They can form teams and take a large population on Medicaid and say this is how much money we're going to charge for that. It's a program that is started, Governor Pawlenty began that. Governor Dayton picked it up to his credit, is trying to push that and try to get better savings. We take the next step within this bill. I think that's one that the governor could and should take in a final agreement that actually will save money. So those are some of the savings that were brought up within this bill. I hope that the governor carefully considers this. We do need to find savings within this bill because we do need to have some additional spending within this. We also need to find savings long term, and we can and we will. The Majority Leader Pepin correctly stated the process that we got to for this, where the governor came up and said, well, we can't do this until we have joint targets. We need you to agree on this. She was absolutely accurate about that. We were given very little time to kind of move this thing together without the governor involved. The conference committees came together and they came out with joint targets with the House and Senate, put conference committees on the table, and we agreed to those and left them in the conference committees. Why? That's what the governor wanted us to do, to engage. And I know that it's difficult to deal with the party opposite, particularly if you're dealing with a House and a Senate. The governor referred to that as dealing with crocodiles and alligators. But that's the government that we have. And we can't just simply wait until the last minute to try to come to an agreement and to slow roll this. We need to actually do the people's work. So I commend the Majority Leader for doing so and for moving this along. I hope that that will lead to a productive conclusion, that these pieces will be there. We are very, very few degrees from where we're going to wind up. And I think the inflammatory language around that in this chamber, in the Senate chamber, and in the echo chamber around us, when people from around the state of Minnesota look at it, they say, you know what, I bet you the people that I know in my hospital, my clinic, my town are actually doing a good job. They need you to do yours. I'd appreciate a green vote.
Seeing no further discussion, the clerk will take the roll. Members, please vote. Member, please vote. The clerk will close the roll. There being 76 ayes and 56 nays, the bill is repassed as amended by conference and its title agreed to.